Individuals who suffer from a debilitating dependence on drug use are often negatively referred to as drug addicts. What is usually portrayed in regards to these individuals suffering from these addictions are their criminal past or current state of living due to their drug reliance. These obvious detractors limit the quality of treatment struggling individuals receive when admitted to hospitals through the negative interpretation of their addiction, lack of available or consistent resources, or just being detained in prison. My topic today is whether drug addicts should receive treatment in hospitals instead of prisons. My credibility, I personally know family members who have overcome drug addictions. My grandmother Ruby overcame a methamphetamine addiction. I have close family who are still struggling with drug use, who are still in and out of prisons from drug-related incidences, and I've also conducted research on this topic for the extent of this assignment. I'll expand on three main topics: the history of drug treatment within hospitals. Afterward, I'll discuss particular advantages of drug treatment in hospitals and live prisons, and then finally, I will delineate some disadvantages of treatments at hospitals. My first main topic for this discussion is the history of hospital treatment for drug addicts. The need for assisting individuals struggling with drug use has been paramount in the early 20th century, just as much as it is today in the 21st century. In the 1978 Drug Addiction and U.S. Public Health Service, Dr. Martin informs that the first hospital to assist with drug addicts opened in Lexington, Kentucky in 1935, and it was called the U.S. Narcotic Farm. In 1936, the name was changed to the U.S. Public Health Service Hospital, and in 1938, another U.S. Public Health Service hospital was opened in Fort Worth, Texas, to assist with drug addictions. Later, Dr. Harrison, in her 2001 article, The Revolving Prison Door for Drug-Involved Offenders, states that drug-related prison sentencing increased from 1988 to 1998 due to a 1984 Sentencing Reform Act, which attempted to standardize prison sentencing. So we ended up having more prison sentences and less hospital treatment. Now that we have a little understanding about the history of treatment and the laws that affect drug addicts, next I will discuss some particular advantages of drug addicts receiving treatment from hospitals instead of prison. Hospitals offer a more medically diverse atmosphere for drug addicts to seek the help they require. Roger Watson, Ann Stimpson, and Tony Hostick simply state in the 2004 Prison Healthcare, a review of literature article, that prisons are not primarily focused on health, instead on society, correction, rehabilitation, and punishment for crime. Furthermore, the World Health Organization in its 2014 book, Prisons and Health, describes prisoners suffering from a history of drug use as often having more than one complex mental ailment. Hospitals have specialized staff that can help identify, counsel, or treat most any mental or physical illnesses that would create a dependency on illicit drugs. Solving the underlying issue can be more beneficial to individuals than simply curbing their drug addiction. If drug addicts receive proper health and rehabilitation, they can start repairing their lives, they can go back to work, back home to their family, and be a part of society without the demands of time, money, health, and the sacrifice of addiction. Dr. Wakeman's study in the 2017 article, Inpatient Addiction Consultation for Hospitalized Patients Increase Post-Discharge Abstinence and Reduces Addiction Severity, suggests that hospital-based treatment, which includes pharmacotherapy initiation, brief behavioral intervention, and direct linkage to outpatient treatment, is effective. That's similar to the first medical officer in charge in Lexington in the 1978 article, The Drug Addiction and the U.S. Public Health Service's 4 Elements of Hospital Treatment. Now that we have discussed certain advantages of hospitals, finally, I will delineate some disadvantages of hospital treatment and its limits. There are many factors that inhibit drug users from continuing a treatment after both hospital and prison sentences. Some of these factors could be adverse childhood experiences, also known as ACEs, mental or physical illnesses, economic welfare, among others that affect decision-making ability of people, especially struggling with addiction and withdrawal. Hospitals are unable to effectively provide basic needs in an individual's life that influences drug abuse, such as clothing, food, shelter. Christine Velez and Associates in the article, "It's been an experience, a life-learning experience," provide a quote from a patient in regards to the pointlessness of hospital treatment if they don't have food to eat or a home to go to. "I almost see it like being futile because I don't know how I'm going to do when I get back out there because I know I have nowhere to go and nothing. I don't even have a jacket at this point. A sleeping bag? I don't even have that now." Prisons give drug users a place to sleep and food, a rigid schedule, abstinence away from drugs. Drug addicts also have a negative reputation for the choices they've made and the conditions they appear to be in. This leads to negative interactions between drug users and health staff, hospital staff. Velez and Associates again provide a participant in their study of hospitalized patients with substance use disorders. This participant states, "I don't like hospitals because they don't help. They think, I'll bet she's not going to get help. She's a heroin addict. This is what we see in all heroin addicts." These interpretations and perceptions are deterring individuals from reaching out and receiving proper hospital treatment. In closing, I have discussed whether drug addicts should be sent for treatment from hospitals instead of prisons. I want to discuss 3 specific areas about my topics. I have expanded on some history of treatment for drug addicts in hospitals. I've also discussed some advantages of treatment at hospitals instead of prisons. Finally, I've delineated some disadvantages of treatments at hospitals instead of prison. Drug abuse has become even more rampant than when the first hospital was opened to assist drug users in 1935. The drug addicts then and today have the potential to be your family, your friends, colleagues, or normal day-to-day acquaintances. They need proper medical treatment, rehabilitation, and community to ensure they safely and certainly kick the addiction. They can overcome their addiction with the proper help without having to pay for their addiction in prison. Just ask my grandmother Ruby. Thank you.